Did you know that communication is one of the most crucial components in healthcare? Effective communication is detrimental between healthcare providers and patients. This topic is extremely important for the sake of you and your loved one's health because miscommunication in this profession can lead to malpractice or potentially death. The purpose of this speech is to highlight important communication skills needed to be successful in healthcare. Do not fear, as this information is provided in order to better your experience as a patient or enhance your career in this profession. I have gathered information from credible sources that cover some important communication skills in this field. The main communication concepts that I will be covering are interprofessional communication, listening, open-mindedness, empathy, and intercultural communication. You can benefit from learning these skills even if you don't have a career in healthcare. You will be able to pick up on these communication techniques and determine if you are receiving adequate care. This information is important to you because you and your family might experience interactions with healthcare providers. Healthy communication is needed to protect patients and increase day-to-day operating efficiency. Communication errors in the medical field can be found as a lead cause of death, but they can be easily preventable. At least 44,000 Americans die a year from medical errors. More than 6,000 Americans die a year due to medication errors. Communication failures made up 30% of malpractice cases in 2016. Interprofessional communication is when healthcare providers communicate with other people, such as coworkers, patients, and their families, in an open and responsible manner. Interprofessional communication teams value coordination, collaboration, and frequent communication as important tools for satisfying clients. Routine and reliable forms of communications should be established. The precise tools for communication may vary from practice to practice, but they should be planned thoughtfully. Importantly, effective communication skills both elicit and accommodate the needs and desires of individual patients or clients. Active listening in healthcare must be enforced. You should eliminate any potential distractions, such as cell phones, laptops, and side conversations. You must take time to consider your responses before speaking and repeat back the information presented so it's clear. You should always summarize the conversation and then lead with an open-ended question like, "Did I get that right?" Listening goes hand in hand with open-mindedness. Open-mindedness is the willing to question current thinking and be receptive to possibilities, ideas, and different perspectives. You should listen to different opinions and explanations carefully without prejudice. It is important to respect patient ideas and thoughts in a respectful manner, as it often relates to their health. If your client expresses that they want to take a different medical approach, you should be understanding and sit down to talk about all the available methods. When considering someone's thoughts or opinions, you should always show empathy. Empathy is the ability to understand and share another person's emotions. In order to empathize, you must put yourself in another's shoes and feel what that person is going through. Be aware of your patient's fear, anxiety, pain, and worry. Expressing patient empathy advances humanism in healthcare and enhances the patient experience. Patients want to know they are receiving the very best care from a medical team that is empathetic and compassionate. Expressing empathy is highly effective, which builds trust, calms anxiety, and improves health outcomes. Often patients are quite uneasy, so healthcare providers need these skills to be able to gather personal information and reassure them. Medical providers must utilize empathy when informing patients about their condition and their possible treatments. Healthcare providers are required to empathize and communicate with many people of different cultures. Interactions between people from different cultures are becoming increasingly common in healthcare settings. Intercultural communication studies communication across different cultures. Typically, medical professionals only speak their first language, but many interactions are likely to occur in a professional's non-native language. Risk to patients increase when medical professionals lack the needed skills to communicate effectively with their patients. If healthcare providers are unable to communicate with people of other cultures, it increases the risk of miscommunication or communication errors. I discussed with you today the importance of interprofessional communication, listening, open-mindedness, empathy, and intercultural communication in healthcare. The purpose of this speech was to help you understand the importance of proper communication in a medical setting, as it has serious consequences if not taken seriously. Interprofessional communication focuses on collaboration and frequent communication in order to form a strong relationship with clients. Listening involves getting rid of any distractions to completely focus in on your patient's thoughts and needs. Utilizing open-mindedness can help you bond with your client and show them that you genuinely care about their opinion. Empathy is used to rationalize and understand your client's emotions. Lastly, intercultural communication is consequential for speaking and understanding clients of different cultures. Do you feel confident determining whether or not your healthcare physician is providing you with the best communication possible? I spoke on some of the best and most beneficial skills that should be put to use in this field. By following these communication steps, the best medical practice should be established. These communication skills strengthen the bond between medical professionals and clients and provide a satisfactory experience for the patient. Thank you. I look forward to hearing the rest of your speeches.